We're looking at two topics touching on our health, and we're going to be looking at how and where to solve issues of infertility in men and in women. And if time permits, we also are going to be looking at basic health neglects that are killed, especially in Africa, Cameroon, precisely, and how to get help. How soon should we rush for assistance? How soon should we seek medical attention when we are faced with issues of our health? We are discussing this with someone who has been doing so much in the domain of health in Cameroon, the Southwest, and currently is also doing a lot in the littoral region. We're talking about Douala, Cameroon's economic capital, to be precise. We're going to be discussing this evening with Dr. Soliman, who has been touching lives from very modest perspective. He has been doing a lot of health education to help also prevent some of these health issues that are disturbing our lives. Dr. Soliman, we're glad to have you on Prime Hour for the very first time. Good evening and welcome.
Good evening, good evening, good evening, everybody out there, and very happy to be here. Thank you, sir.
How are you doing?
Fine, fine, thank you.
Okay,
thank you.
We hope that the health unit that you are also leading in Cameroon is doing well.
We're doing very well. Love it very much.
Okay.
Thank you.
Okay, Dr. Soliman is going to be talking to us this evening with a Pan-Africanist. He also wants to see Africans doing well. He's always there to remind Africans to take care of themselves. He's been talking a lot about taking care of the Africans from the political perspective, but today is going to be advising Africans to take care of their health. Professor Anthonny is in the house with us. Good evening and welcome.
Good evening, Mr. Leo, and to my fellow panelists, Mr. Soliman, Dr. Soliman, and to you watching us out there. I want to believe that health is wealth. And a person who is healthy has the capacity to bring to table whatsoever he or she intends or wants. But we have a problem in Africa that we at times do neglect our health and focus on things that we do not even know that can actually destroy who we are from within. So we'll be discussing more on that in this topic.
Okay, also with you, Dr. Soliman. This evening we are talking infertility in men and in women, what to do to fix the situation, what to do to fix the situation. You have to add "to fix the situation" on the screen there. Desmond, please. Dr. Soliman, how acute is this problem in Africa, in Cameroon? Do you encounter it amongst couples?
Well, it's very common. It's extremely common. And it's something that is really, you know, a concern for those couples who cannot have a child. Maybe they have one, they want a second. To prove that to you, the views for that session that I put in infertility in the first 2 days was like 41,000 views in Facebook alone. I don't know about the other media, and I don't know about TV. But obviously, it is something that has gotten a lot of attention, and a lot of people out there are very much concerned about infertility, whether about women or about men. There are infertility problems with men, and it's always accompanied by erectile dysfunction. And that always comes with premature ejaculation or fast discharge. We have dedicated a session, I think, last week on just the male sexual problem and male infertility. And female infertility was the session before. To sum it up, yes, there is quite a big problem, not only in Cameroon, but in Africa. We love kids in Africa. We love to have babies in Africa. It is something very nice. And no couple should be deprived of having what they want. Sometimes the problem is very small and it could be fixed if, and notice this, underline this many times, if it's caught early and taken seriously. For example, You had one child before. Now you've been trying for the last 4, 5, 6, 7 years, and you have not gotten a child. What does that tell you? Your system was fine before. You were able to conceive. After a few years, something had gone wrong, and you can no longer conceive. I have seen a lot of stories that were successful, and I have seen also, on the other hand, stories that were not very successful. What I'm trying to say here this evening is the following. When you notice there is a problem, please take care of it. The most common cause for infertility in men and in women is actually infection, STDs, sexually transmitted diseases. We ignore the fact that those problems can really cause in a woman what is called internal adhesions. The tubes of the woman from the inside will be adhesed, meaning if you think about the tubes, the fallopian tubes in a woman, they are very thin layers. So if we get adhesions from inside because of chlamydia, that is the most common cause, we have a problem. What if we catch chlamydia early? What if we practice safe sex? What if both of us as sexual partners is checked very well, and we don't invite anybody that is a stranger to the circle? We remain clean. We will not be facing infertility problems because of something we had acquired, whether men or women. Sexually transmitted disease in a man and in a woman is the most common preventable cause of infertility.
Okay. Yes, we are talking about infertility in men and in women. Please, if you have maybe a friend who is facing this situation, or a lady or a man, I think this is a program for them to follow, so that they should understand where the problem probably is coming from and how to go about it. But from the Pan-African perspective, it is a very big problem to have a wife who cannot reproduce, give you children, bear children, and most often the blame goes to the lady, because naturally people have the impression that the man must always be able to produce. Yeah,
that is very right, Mr. Liu. If you have to investigate in our African culture, to be precise, you realize that infertility is always directed towards the woman, not towards the man. Why? Because there is this mindset that if there is a problem when it comes to fertility, it is coming from the woman. But that is not true. It's not true. Most at times, infertility cases in Africa are actually coming from men, not even the women. But I will say this: if you look among, statistically, if you look at 7 couples, 1 of those couples in Africa has infertility problems. Among 7 couples, 1 of them is having infertility problem. And it is as a result of several things. Some of them are hereditary. I think Dr. will best explain that. Some of these issues are hereditary, depending on the hormonal production of that. Some of them has to do with, let me say, the low sperm count. There are reasons based on the lifestyle somebody lives. Some people consume whatsoever when it talks food. It comes to marijuana, the smoking marijuana, cocaine, all those stuff, they play a lot when it comes to the fertility of a man. And you also have psychological issues. Some people want to use the word trauma. Psychological issues play a lot on the productivity of a man. And most of the times, people don't take these things into consideration. And as long as they do not take them into consideration, you see, they don't see it as any problem. They just believe that they are fine. You see a man who lacks sexual desire, and he is believing that he's going to impregnate a woman. That's already a problem. He has a sexual problem. He practically does not want to, in fact, even if you give him the opportunity to stay in bed with a woman, he will run out fast. And those things, people don't consider them, but they are having a lot of meaning. And I will say this, Mr. Leo, doctor will best explain these things using terminological, health terminology. But from the local viewpoint, the African man has a serious problem with the way he looks at his health. From that perspective, I'll tell you, what we eat has a lot to do also with our reproduction. It has a lot to do. I know most of the times we eat anyhow. And that is one of the things we need to be able to control in order to also control our productivity. Okay. And that, I'm saying this because, let me also add women in it. If you look in Africa, women are practically almost the best. It has a lot also to do with productivity.
With productivity.
So most of the times these things play and we do not put them into consideration. Okay. We only look at the fact, like doctor mentioned, you can have gonorrhea, which can cause problems. Syphilis, you can have HIV.
Yeah, but doctor, you have worked in this domain for long.
Yes.
Please, if you are watching us and you are facing that situation, you can help.
Yes, of course. Okay. Of course.
You can help. So if you're watching or you have somebody who has that problem, a doctor can help advise or direct you on how to fix the problem. But you have met many couples, especially in Cameroon, and the tendency, many people think that the child, the lady cannot bear a child because they are barren, and not necessarily because of the man. What is the proportion of men who are infertile?
Well, believe it or not, Mr. Leo, I've seen a lot, and young men in their late 20s, early 30s, who do not have the sperms.
Okay.
And sometimes even do not have the sexual desire. And of course, if you cannot have a sexual desire, you cannot erect, and you cannot have successful sexual intercourse. A lot. Now, like my professor here says, it could be psychological, especially when it comes to young couple, young men. Most of the times it's psychological. So we basically ask them, do you have an erection early in the morning? If the answer is yes, so that's definitely proof that this case is psychological case. A psychological case. So yes, the head, the brain has a lot to do with it. It all starts from the head. Sex does not start from below the waist. It starts from above the shoulders, from the head. It's all in the head. The desire, the thought, the touching, everything reflects in the head. And then it's a mechanical work that is down below for the erection, which is just inflow of the arterial blood into the penis that it causes the erection. And yes, absolutely right. The one to blame for infertility in Africa, most of the African country, is the woman. Yet he get another woman and it's the same issue. He cannot have a child. And get a third woman and it's the same issue. Even a male or a female child, they always blame the woman. And it's absolutely wrong. The man is the one to blame because it's a Y chromosome on the sperm that determine the child is a male or not. So if the winning sperm, the sperm that win the race and hit the egg is a Y, then the child most likely, not most likely, definitely is a male. But if it's an X, then it's definitely a female, because the female does not carry the Y chromosome, it's only the male that carries. So it's the male that determines the sex of the newborn, not the female. And yes, I cannot say, see, sexually transmitted diseases, as it affects males, it also affects females equally. The damage is both in the male and in the female. In the male, you will notice that the sperms, the ejaculate, become watery. And the patient will come to me and say, oh, that's when after my husband ejaculate, it comes out. And that is because there is no viscosity, there is no sperms, there is no particles there, which are the sperms. It's all watery. The sperms are no longer there. That's why the ejaculate is very watery. Now, If this problem had happened recently, meaning at one point on time of your life you were doing fine, and then later on you notice the problem, this is an acquired problem, something that you have gained. But if the problem was there since birth, that's what we call congenital problem. You were born with it. Like many of the chromosomal diseases, right? Klinefelter, a lot of diseases, for example, but here is the differentiation now. We cannot call you have a genetic disorder when you already had a child, and now for the last 10 years you're trying to get a child, but you cannot. This is something that you have acquired. And most of the times it is an infection that has been ignored for years, long enough to destroy the testicles, because remember, the testicles are the factory where you make two things, the sperms and the testosterone. And is the testosterone that is responsible for the desire, the sexual desire. Is responsible for strong muscles. It's responsible for strong bones. So without testosterone, really, you lose a lot of things. So in this case, when, for example, somebody got an injection by mistake and the testes are destroyed, and I think I played a case like this during my sessions, whereby a young man was previously fine, took an injection, high dose cortisone, for example, and it killed the testes. Now the man, instead of having a testes, he has no testes, he has no ejaculate, he has no desire towards women, and add to that, he already grown a breast very much the same size like a woman. This is because the testes are gone. So the testes are very important in a man's life because of those things that I have just mentioned. And it could happen by wrong medication that you're taking, or STD, sexually transmitted infection that you have been exposed to and you didn't know, because those infections are silent. Especially in a woman, they are silent. So the only way to find out, if you have doubts, you go and get tested. Then the doctor will look with ultrasound to see if there is signs of infection in a woman. In a male, sometimes you get discharge from the penis, that also indicate, and most of the times it is just silent. Now, when it becomes silent, that is very bad, because it goes to the testes, it damages the testes, it goes to the epididymis, it damages the epididymis. At the end of the day, you will end up with watery sperms, and most of the times, actually, if it's ignored, the damage is beyond repair.
Doctor, we have persons who would live with their husbands for 10 years, and because a child is not there, that is when they start finding out whether they are fertile or not. What are some of those symptoms that you easily note that either the man or the woman is infertile?
Well, they've been trying to conceive for sometimes, and despite frequent sexual intercourse, she cannot get pregnant. And the woman will always tell you, when my husband ejaculates, the ejaculate comes out like water. It doesn't stay inside. This is how they describe it. And this is exactly what it is, because it is not retaining viscosity and weight, because there's no sperms there. And that is how they describe it. And that's how you know. But it is very frequent. You know, the woman is the one that comes and complains. The men hardly complain. I don't know, is the ego thing or what? I have no idea. But mostly is the man, is the woman that comes and complains, and maybe also the society put too much pressure on the woman, that she is the one that is running, oh, you know, the husband family cannot accept me, his mother doing this because I cannot have a child. There's a lot of stress in the woman because of the society and the culture behavior, and how they behave towards a woman that cannot bear a child. You know, it's very terrible, really. But you know, I would say 50% of the cases is the male factor, is the man. And it's for a simple reason, just ignored infection that has been there for a while.
Okay, so these are revelations that are made public by Dr. Soliman. 50% of the situation is the man who is responsible.
Yes.
In cases where the child is not coming out.
Yes.
But why is it always very difficult to note? Is it ignorance? Why do people feel that it's automatic for the man to be fertile?
You know, we in Africa, we have a background where infertility was something that was not normal. In fact, we never knew anything about infertility. Back then, our ancestors would tell you that. Our grandfathers would tell you that. And so it becomes difficult when in a family you start seeing a young man being unproductive. They are struggling to ask the questions. What happened? How did it come? But they fail to understand that with modernity and the so-called civilization that has approached, a lot of persons have been exposed to different kinds of lifestyles, which in one way or the other tends to hinder their fertility. I learned of a situation called the chromosome defect, where a male factor is born with 2 X chromosomes and 1 Y. In such a situation, how do you expect him to know that he has a defect problem in his chromosomes? He might not be fertile. He does not even realize it. And the male organ will never be well because it will not, in his development, will not develop well.
Correct.
In such a case, he can never be that fruitful. The question is, in this case, how would the person know if he has not been exposed to a doctor? How would the person know? It will be very difficult. It is something that is in him. There are some situations that are hormonal. They don't know. They only need to then visit a doctor. And like you asked the question to the doctor, when should someone visit a doctor after you realize this? I think if I make 1 year already in my marriage, which is not by my decision, and I'm not able to put to bed, I need to start looking for solutions. What is wrong? 1 year is really enough, because if I have to say no, I'll go another year, questions will start coming. And in Africa, those questions will come immediately. When 1 year passes, the next year, they will start asking those questions. What is happening? So I think 1 year, after 1 year is enough for a couple to say something is wrong. If they have been looking for ways to get pregnant, the wife to get pregnant and she's not getting pregnant, then there's something wrong. They should.
Okay, those of you watching and having friends with this situation, you could send us SMSs. We will put them through to the doctor, who will either ask you to meet him or give you a response straight away. Good evening, sir. I'm currently enjoying your program and will appreciate if it's possible to have the doctor's number. Where are you writing us from? Always indicate. I will send you. Doctor, can I share a number with them?
Yes, please.
Okay. I will send you Dr. Soliman's number so that you can get to him after the program. Yes, you have doctor's number there. Now, doctor, we have couples who would live for 6-7 years without a child, but they end up getting pregnant without necessarily going to the hospital, or I don't know what happened. Why does it have to take so much time? Well, for the child comes.
Well, to be perfectly honest with you, you know, if it took 7 years, they were trying, and then
it comes.
Happens. So that means they have followed some kind of treatment and they solve the issue. That is most likely what happened. But yes,
I just wanted to say, I have a friend who stayed in marriage for 17 years without a child. And as a pastor, he thought the best way to handle it was just to pray. Until a lady left a village, came with some herbs and gave him to take. And after that, he put to bed. So the question I've been asking is, what were those
herbs
which they used? And I discovered that when you get to a kind of ethnopharmacological data, there are some herbs which you can identify as well, which could be used for that. But this, I am not naturopathist that can prescribe.
Prescribing.
I'm just saying that something like that happened. I believe that the doctor has a better option for people who are suffering from such a situation. I just want to tell the German say something about that.
Okay. This one says, good evening, sir. I am one of them. Please, when you write, tell us where you are writing from and your name also. We want to know that. For those who want a doctor's number, I will send the number to you, especially after the program. Good evening, sir. Please, how can I get the doctor's number? I'm Elvis. I'm writing from Bomenda. Okay, Elvis, I'll send you doctor's number. Good evening. Good evening. Stop the calls. Just send a message. Send a message. I'll reply you. I'll send you doctor's number. Good evening to the professional crew. I am 30 years old. I have been facing a problem of sexual weakness since I started knowing a woman. I can rarely have the feeling to sleep with a lady, but when we get to the act, the feeling goes. I only take some drugs like Viagra before I can have sex, and the sperms doesn't come really much. I really need help, please. Pascal is writing from Douala. Pascal, a good evening to you. Doctor, can you understand what he says?
Yes, of course. Very common problem. Pascal, how old are you?
He says 30.
30 years old. So, Pascal, I would ask you the question, when you woke up early in the morning, do you have a normal erection? I mean, without the wife being there, early in the morning, 4 o'clock, 5 o'clock when you woke up, there is an erection? If the answer is yes, then you have a small problem. Your problem is psychological that we can easily fix, is not a problem. Now, when you say the sperm come out small, well, let me ask you a question. Is the sexual desire there? Meaning, do you have the desire to see and be with a woman? If the answer is yes, then we have not to worry. We do not have to worry about the head, because the head is okay. So now we have to worry about psychological issue, possibly. And the second thing, with the small amount of sperms, we have to run an ultrasound on the testes and see if each one, the long axis of the testes, is more than 3.6 centimeters. If the testis size are good, then we know there is possible irregulation or no good stimulation from the brain, because we have hormones that come from a gland in the brain called the pituitary gland. Those hormones are called FSH, follicular stimulating hormone, and LH, not necessarily has a lot to do with this spermatogenesis, making the sperms, but the gland has to be good. Now, sometimes we have a hormone that is called prolactin that is coming from the pituitary gland, and this hormone sometimes is high. When this hormone is high, it inhibits the reproductive axis in a man and in a woman. So it will be a good thing to measure the prolactin. In a woman is easy, we don't even have to measure. If I squeeze the woman's breasts and milk or discharge comes out, I know prolactin is possibly high. So I need to measure it to determine how much treatment I need to give. But in a male, you cannot have, even if the prolactin is high, we squeeze the male breasts, nothing will come out because the male needs estrogen, which he doesn't have. The woman has a lot of estrogen because the ovaries produce the estrogen. So it's the combination of prolactin and estrogen that make the breast produce discharge when you squeeze it. In a male, we cannot do that. The only way to find out is to measure the prolactin level in the male, and that is sometimes the case. We fix the prolactin level, everything goes back to normal. Okay.
Hello, Mr. Leo and the panelists. I'm a great fan of your program. This topic is something that concerns me a lot. I have a teenage son, 14 years of age, whom I got while in Upper Sixth. When I was in my training school, I had an ectopic pregnancy. Now I'm done with school and working, but have been trying to conceive for years now to no avail. Doctor, what can I do with such a problem? I'm Sandra from Bomenda. I'm 35 years. Okay, doctor, what is the problem? She conceived while at Upper Sixth, and then now it's impossible.
That is, Mr. Leo, a very common problem.
Okay.
Early in age, she can conceive, everything is okay, the system is still fresh. And clean. Once we get an infection that we ignore, most likely, most commonly, I'm not saying this is her case, I'm saying most commonly what happened, chlamydia, that all chlamydia goes there and stays there, and it causes internal, when I say internal adhesion, meaning if this is the fallopian tube right there, inside the tube we have an adhesion, like a spider web. So the sperms cannot go to meet the egg. It gets stuck because of those internal adhesions. So if we have external adhesion because of a previous surgery, it is easy to fix. We'll go with laparoscope, we cut the adhesion, it's fine. Internal adhesion now is hard to fix. It's hard to fix. So sometimes we use a technique to push something from the cervix to open the tubes. Sometimes it's successful, sometimes it's not. Most commonly is complication of chlamydia causing internal adhesions of the fallopian tubes, leading to multiple ectopic pregnancy. If the sperm cannot make it all the way through to the ovaries, to the fimbria, where the eggs are, you know, then the pregnancy is gonna get stuck where? Right next to the ovaries, in the adnexa, in the fimbria, next to the ovaries, and that's what we call ectopic. Ectopic meaning out of place. It is not inside the uterus, it's rather somewhere else. Somebody asked me a couple of days ago, doctor, can you bring an ectopic pregnancy from outside, bring it inside the uterus? How? You cannot.
Okay.
Yeah.
So, Sandra, please, I've sent you doctor's number. You get to him to see how to help you. This one says, in Bali, there is annual consumption of hormone boosters which makes the man active all year round, but people are moving away from it. That makes for sexual weakness and low spermatogenes count. Okay, it is an old practice that we should return to. Taiti Emmanuel is writing from Bamenda. Good evening to you, Taiti. Good evening, Mr. Liu. I'm Brandon from Limbe. Does pile cause infertility in men? Bile, does it cause infertility in men?
No. Bile is a totally different problem with the GI system. It's at the level of the rectum, at the anus, above the anus. It could be internal, it could be external. But you see, let me say something.
Okay.
You only can have good sex when you are fully relaxed. When I say fully relaxed, meaning no stressors, whether physical, mental, or emotional. You have to be relaxed. So if you have a little bit of pile that causes pain, would you be able to relax to have a good erection? The answer is most likely no, right? Unless you're really, really deprived out of sex for a long time. So we need to be relaxed. So even constipation, can it cause my sexual performance? The answer is yes. Anything that stresses you out, whether physical, mental, or emotional, can affect your sexual performance and erection. So absolutely. So those young men, most commonly, the reason is psychological. He's stressed out, especially if the girlfriend or wife has been with many others before. He feels like he is competing. So he feels shy off. I'm serious now. He feels shy off. And it reflects on his erection and sexual performance. Yes. So that's an advice for the young ladies out there. You don't have to brag about your sexual experience. You just, even if you have to fake that this man is good, that will be the most effective therapy in him getting good erection and good sexual performance.
Okay, but we compete with him, it defeats him. Good evening, Mr. Liu. I really like your program. Please, can I have Dr. Soliman's number? And Peter, writing from Yaoundé. Peter, those of you requesting for his number, I would plead with you guys to request for this number via WhatsApp. Ask for his number through WhatsApp. I'll send you his number, especially after the program. Mr. Liu, I really like the program tonight. Good evening to you. Thank you very much. Greetings. I'm Gwen from Yaoundé. I got ectopic pregnancy since 2009. Since then, I'm unable. I'm 42. Please, doctor, help me. Can you just call doctor? Request for his number after the program. Call me or write me through WhatsApp. My period overflow and very painful is similar to the situation in Bamenda. Stop the calls, please. Just write me on WhatsApp. I'll send you a doctor's number. Good evening, Mr. Liu. I'm Fabrice. I'm enjoying your program. Thank you, Fabrice. I really like the program tonight. Thank you very much. Good evening, Mr. Liu. Thank you very much. Hello, Mr. Liu. Can you stop calling? When you call, it makes it difficult for me to read the messages. Hello, Mr. Leo. Good evening. I'm Pat from Bamenda. Please, I've observed that my last child is 2 years, but my breast still produces milk when I press. Also, the egg white before ovulation is watery instead of stretchy. What might be wrong, and how can I do to get pregnant? Thanks. Please, can I get a doctor's number? Yeah, doctor. Can we explain what's happening to her?
I didn't get the first part. What was the first? She says.
Please, I've observed that my last child is 2 years,
Yes.
but my breast still produces milk.
Yes, that's a
when
problem.
I press it.
Okay.
Also, the egg white before ovulation is watery instead of stretchy.
Yes, that's the problem.
Okay.
Is the child still breastfeeding?
I don't know. That's just what.
If the child is still breastfeeding, then it is normal. But if you have stopped breastfeeding the child and milk is still coming out, that's exactly what I have discussed a moment earlier, which is prolactin is high. We need to give medication to stop prolactin, and then you will get pregnant, because prolactin, it inhibits the ovaries and it inhibits the whole axis starting from the hypothalamus, the pituitary, and the ovaries. So we need to take care of that discharge coming from the breast. That is the first thing I always do. See if there is milk coming out of the breast and the woman is not breastfeeding. We fix this problem with 2 tablets, and then you'll get pregnant.
Okay.
Assuming there is no other things in the way.
Okay. The person from Yaoundé, you get to doctor. Good evening, Mr. Liu. It's Peter from Douala. My problem is my sperm count is normal, but the sperm I ejaculate comes out small. What can it be? The problem, I'm 29 years. Please answer me.
Well, we have to see most of the times that what we have seen in the spermograms, the sperm's number is there, but the functionality, meaning how good the sperm can swim, is not there. And there is, most of the time, we see some infection there that we have to treat. And then we allow some time for new sperms to come, and they will be normal.
Okay. Good evening to you all. I'm called Blanche from Yaoundé, and I'm married, having 1 child. I hardly have the desire to have sex with my husband, and whenever he even touches me, I feel no desire to still have the sex. Don't really know why. Please, I am enjoying the program. Those of you who are asking questions, can you just get to doctor after the program? I will forward his number to you, please. But what would account for this? Because I'm sure there are many other women who.
Yes.
Yes.
I just met a couple of days ago in a clinic a woman that is with, we call it orgasmic disorder. She's been with the man for more than 25 years, okay, and she never in her life experienced an orgasm. So that's an orgasmic disorder. There is something wrong. And I had a session with the woman and the husband, and it's most of the time lack of communication. There is no communication between the woman and the man. Meaning, what I'm trying to say is the following, and I'm trying to be very open because this is something that you cannot be shy of. If I have a wife, I would like my wife to know what are my likes and what are my dislikes when it comes to sexual intercourse. Vice versa is correct also. So those couple, they must know and communicate to each other about what they like during the sexual intercourse and what they do not like during the sexual intercourse, right? This is a must. So communication is very important for successful multi-orgasmic in case of a woman, 1 orgasm in case of a man, because the man needs refractory time to gain power again and have another orgasm. A woman, no. A woman can have multi-orgasm as long as the man is doing the right job. As long as the man doing, and how can a man doing the right job if the woman does not tell him, this is how I like it, and this is where you should touch, and this is where you should avoid touching. By the same token, the man should know what pleases the woman should know what pleases the man. Communication is in one word.
But this lady says she hardly feels anything, eh?
Well, if she hardly feels anything, then we have a problem with the hormones.
Okay.
Then we have to check her hormonally and see why she does not feel anything. So this is hormonal problem. Then it comes out to desire. That's a desire disorder. She feels nothing. That's a desire disorder that has to be worked on.
Okay. Good evening, Mr. Liu. Please, can I get doctor's number? Felix is writing from Bomenda. Those requesting for numbers, please do that more through using your WhatsApp, please. Good evening, Mr. Liu. I am Anne writing from Douala. Please, may I have the doctor's number so I can advise my sister to visit the doctor? She has been married for 3 years now. Okay. Can you please ask for this through your WhatsApp? Greetings. Good evening, brothers. Accept Easter greetings from this other side of the country. Your program is really thrilling and educative. More grace to you all. Please, doctor, my girlfriend has lost her sexual urge. What do I do, doctor? Please send to me. Your number is Richard. I think it's the same, like you just said.
Same, yes.
Yeah. You get to doctor, maybe he will talk with you. Good evening, Mr. Liu. How can I have doctor's number? This is Basil in Yaoundé. Basil, good evening to you. Hello, doctor. I'm 31 years old got married with my husband for 7 years without having a child. But me and my husband had sex. My name is Claudia. Okay, they have sex all the time, but no child. They need to do checkup.
Yes. They have to be checked. It could be that she is getting pregnant, but she has a big fibroid, and every time the uterus tries to stretch out, the pregnancy drops. Or it could be the male factor. The man is not having a good sperm to conceive the woman. So they both have to be checked.
Okay, they both have to be checked. Hello, Mr. Lee, I want to find out if fungi infection can affect sexual performance. Cyprian is writing from Bankim.
Well, when you have a fungi infection, we have two kinds. We have one kind that smells bad, and we have one kind that does not smell very bad, you know. So we have bacterial vaginosis and trichomoniasis, but this can easily be treated with an ovule inside the vagina, but it does not, and it should not affect sexual performance unless there is an odor. Then the man maybe get turns off.
Okay. Good evening to the panel. Beautiful topic. Please, can I have doctor's number? Thank you for the good job. This is Miss Eta writing from Yaoundé. Miss Eta, I'll send you doctor's number so that you can get through to him. Carlson, good evening, Mr. Liu. Question to Doc: can tomboys be pregnant? Tomboys are girls who behave like boys, possibly due to high testosterone.
You cannot.
Okay.
You cannot. And anatomically, they cannot.
Tomboys can get pregnant.
They don't have the uterus.
Okay. Greetings, Mr. Liu. Can Prof elaborate on the spiritual causes of infertility? This, what we have been explaining.
Yes.
There are
yes, there are.
medical,
yes.
but spiritually, have you encountered some cases?
Maybe the professor can enlighten.
Normally, there are spiritual causes as well. When you can have psychological problems without having spiritual issues. I would say this, in Africa, it is very possible for somebody to be bewitched. And if you are bewitched, that's already a spiritual problem.
Yes.
And for you to get pregnant, you will also need a spiritual solution in that case. That's why I'll be sincere in telling you that man is a holistic being, and when it comes to health, man needs holistic medicine, which implies that you need medicine that begins from your soul to your body. So if you want to ask me how somebody can be affected, I might not know, because
you are not one of them.
I'm not one of those who can cast a spell to cause somebody to be sick, to cause somebody to be to not get pregnant, as well as there's this issue that they say spiritual. You want somebody, you are sleeping and you are having sex.
Spiritual husbands and spiritual wives.
Spiritual husbands and wife. Such situations can destroy your pregnancy even. It can even create a situation of infertility as well. Because you are enjoying the sex while asleep, but when it comes to the physical aspect, you don't like the man or you don't like the woman. There's something wrong. It's a spiritual situation. So in such a situation, my advice is you need to contact, I don't know, should say a pastor or a priest to assist you in that direction. But to come back, I wanted to say something. We have been talking about low sperm count. Low sperm counts has two different ways in which I just want to use my own understanding of what I understand and know about it. Where at times you are the tubes that transport sperms cells to your semen are actually at times blocked, and the flow of it is not not going through.
Doctor,
yes, correct. This is obstructive.
Yes.
Obstructive.
I'm not just talking what I do.
Don't teach people.
Doctor is here; he can confirm
correct,
what I
that's
say.
correct.
Yes. So,
you can be producing the sperm,
yes.
but you cannot let the sperms out because
out.
there is an obstruction.
Obstruction. Voilà.
And simply we do something very simple. We go to the urine and we take a sample from the urine. We look under the microscope and we see the sperms.
Okay.
So that's an obstruction cause for azoospermia. No sperms. Sperms are being made. You know that when the sperms are made in the testes.
Yeah.
Then they are transported to a storage room. And this from when you ejaculate, the sperms come out of the storage room and boom, being ejaculated. If there is an obstruction in that, bath where you ejaculate, then you will have no sperms.
No sperms, yeah.
So they rather go now, and instead of going forward to outside to the vagina, they go retrograde. They go backward to the bladder. And that's what we call retrograde ejaculation. It happens mostly in diabetic patients. This is one of the complications of diabetes. But we also see this in young men, like you just explained.
Okay.
Yes.
So I was saying that's one of the ways. Another is the fact that you are, when it comes to the production in your production chamber, your testicles are not producing enough sperms which are able to, let's say, impregnate a woman. For example, in a sexual relationship, you need at least 39 million sperm cells to impregnate a woman. Anytime that it goes lower than that number, you can't impregnate a lady. So you need to find out, by meeting a doctor, to find out how they can increase your sperm count. That is something that the doctor can best handle. I'm just speaking from studies, not from
you're not a medical doctor.
Medical direction.
Okay.
Yes.
Good evening, Mr. Liu and members of the panel. Can infertility be attributed to witchcraft? Dr. Esther Bisson is writing from Kumba. Yes. There's witchcraft, huh?
Yes.
Yeah, can I say a couple of words on spiritual?
Yes, yes.
In my field, I get a lot of spiritual cases, especially mental cases. So spiritual attacks and spiritual disorders, spiritual disease is a fact. Like we are bodies, we also are souls. And the souls can get affected, and affecting the soul can reflect on actually real physical disease.
True.
So I'll summarize very briefly. We have to be very careful not to be delusional. Delusional meaning believe in something that is not real.
Not real.
But spiritual and witchcraft are real. Yeah, people can get hurt, and yes, it can be cause of infertility. Yes, for sure. But how does it do it? I'm gonna explain just one small example that I had about a month ago. A lady comes into the clinic with positive pregnancy test. How do you know you're pregnant? I did a pregnancy test and it was positive. I did the ultrasound. I do not see any pregnancy inside the uterus. So that means it has to be ectopic. And I did see it ectopic. I sent her to the lab again for pregnancy test and it's positive. So the lady has ectopic pregnancy. I told her in this case, the pregnancy is advanced, so we can do it with injection to drop the ectopic. Or if you wait too long, then we have to do surgery to take out the ectopic. And I'm not a surgeon, but I would recommend a colleague of mine to do the surgery. So, her question now, she went to another doctor, okay, and they told her, no, it's a cyst and it's gonna drop, but obviously it cannot be a cyst because positive pregnancy test and you have a pregnancy that is not in the uterus, that cannot be a cyst. Anyway, she waited and then she sent me a question. Can this positive pregnancy test because of a spiritual, because I get a lot of spiritual dreams, spiritual husbands. I see vivid sexual dreams almost every night. Now, my answer is no. You cannot have a positive pregnancy test because of a spiritual husband. You know, we can have virgin girls that have vivid sexual dreams almost every night, and they're still a virgin. So what that means, she having sex spiritually, but not physically. Let me explain something very small about the difference between spirituality and us as a physical human being present here, for example. When God created us as human, this is one entity. He created us from mud. That is something physical. You touch, you squeeze, you see in your hand, mud. When he created another entity from fire, you cannot hold fire in your hand. He created a third entity from light. You cannot hold light in your hand. But who you can hold in your hand? The mud.
The mud.
So we are more dense. They are made of very light density. We are made of very heavy density. That's why I can touch me, I can touch you, I can see you, you know. Now, that is the difference. That is the whole mechanism of spirituality. Something that you do not see, not because they don't exist.
Not real.
Yeah, they exist. You cannot see because you are only allowed the spectrum of sight. When God made it, He made it from 1 to 10. For example, 1 to 10 is spectrum of sight. Human allowed to see from 1 to 2. So I can see only 1 to 2. But in order for me to see other entity, I have to go high on the spectrum. So I can see the infrared, and I can see the ultraviolet, the angels. I can see the jinn, or the ghost. That is the infrared. It's actually supra-red. Infrared is a misnomer. It's not the correct terminology. Okay. So God did not give me the capacity to see them. They have better capacity to see me. I cannot see them. Now, it happened in some cases that human can see them. What happened here? That means the spectrum of sight has increased to allow that person to see other entity. And it is true. Patients with schizophrenia, they see entities, and those entities are true. They're not fake, and they're not hallucination in most of the times. It is real. They see other entities, and they see what they are, and it scares them off. And even sometimes they establish a relationship with them. They talk back and forth to each other. This is what we call patients talking to themselves. But they actually not talking to themselves. You cannot see. He sees. It doesn't make it unreal. It is real. It is existing. So what is now witchcraft? What witchcraft do? Witchcraft is something very evil, because I'm playing with the soul. I'm playing with the unseen. You cannot see. That's why you cannot judge. I cannot judge you. I cannot take you to court because I cannot. You don't see what I'm saying. And there is no court in this earth that say, okay, you gonna go to jail because you're doing a witchcraft on somebody. Because this is the unseen. I'm playing with the unseen. I know some secrets about the unseen, and I'm using them not to help you, but rather to hurt you. So that's why those people who do these things are very evil, and they are promised by God hellfire. Now, how does it work? The mechanism is very easy. Now that we are very dense, and those entities are very less dense. So that means they are like energy. They are like waves. They are shapeless. They are weightless. But they can attack you. How? With their speed. They travel 1,000 miles a second. So if this high energy, boom, come and attack you, you tremble. If they come, it's about ideas. Now, if they come and whisper in your head, your husband looks like a monkey. Your husband is no good. Would you touch your husband? Always you see, because they play with your imagination and your mentality. Now you see your husband that used to be very handsome. You see him
Like a good
very ugly, and vice versa. So the relationship is already destroyed. You know, and
from the spiritual.
Of course, the separation between a man and a woman is a spiritual issue. Yes.
Good evening, Mr. Leo, and to all the panelists. Thank you for today's topic. I'm learning a lot. This is writing from Kumba Success from Kribi says, good evening, Mr. Leo. Nice program. Can doctor teach me how to follow my ovulation period? I have been trying to take it in, but it's not coming. My son is 3 years old. Success. You have Dr. Soliman's number. Get to him on, just call him. I'm really, this one's Sumbele Kelvin. Konsamba says, I'm really learning. Keep on bringing this type of programs on Prime Hour. If possible, mix and bring a holistic doctor too. Let us get from both ends. Good evening to you, Sumbele Kelvin from Konsamba. Hello, Mr. Leo. My mantra flow this month was low as compared to previous months, dark in color and painful as well. What could be the problem? Ebude is writing from Yaoundé. Please, Ebude, can you just get to doctor? I've sent you his number. Get to him. He will talk with you. If we have to answer every question, it means we'll finish it tomorrow. Eh?
Now, we will do the ovulation. She wanted to know how to calculate the ovulation day. It's very easy. And it's always, you know, you don't want to miss pregnancy because of you do not know how to calculate ovulation. When is ovulation? It's very easy. When you get your menses, and that is regardless of how many days is your cycle. Meaning, if you have a cycle that is 21 days, it's fine. 14 days is fine. 31 days is fine. 100 days is fine. Because the mechanism is the same. You take day one of the menses, and you say, that's day one. Now you count 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. That is day number 14. That is the ovulation.
Day of ovulation.
No matter how long is your menses, it's always, if you're human, you ovulate in day 14. Now, when is my window of opportunity to have a child? Well, it's going to be one day before the day of 14, that is the 13th. The ovulation day, which is the 14th, and then another day after the ovulation day, which will be the 15th. So 13, 14, 15 day, counting the menses day number 1 as day number 1, 13, 14, 15 this is your ovulation, your window, your opportunity window. Meaning, if the man ejaculates the sperm stays 48 hours alive. So you have a window there. The egg stays 72 hours. It's still acceptable to be fertilized. So this is your window of opportunity, 13, 14, and 15, counting menses day number 1 as day number 1. Okay. This is very easy to calculate.
Okay. Good evening, Mr. Leo. I'm enjoying your program. Please, can I have Dr. Soliman's number? I'm Anita, watching from Chang. Good evening to you, Anita. You will have doctor's number. This one says, good evening, Mr. Leo. Please, for doctor's number, you have an interesting health program. Good job. Sir, thank you very much. You guys will get to doctor after the program. Good evening, Mr. Leo. I'm a health practitioner and need Dr. Soliman's number. Still waiting for doctor's number. Okay. You want to exchange notes with him for collaboration. That's great. Good evening to you all. Please, is masturbation a spiritual problem and is it advisable? Thanks. Annie Yefon is writing from Yaoundé. Good evening, Mr. Leo, and to everyone, parents. Okay, yes. Somebody also asks whether masturbation can cause infertility.
Yes, okay.
Yes, if that case.
Yeah, can I answer?
Yes.
Okay, masturbation, you know, they teach us that in medical school. It is something normal. A child masturbate, a boy masturbate, young people masturbate, young women masturbate, old fellas masturbate. So masturbation is a normal, healthy, sexual behavior. When it becomes pathology, when it becomes disease, when it's more than too much, if you have to stop your daily activity to masturbate, that's a problem. If you have your wife next to you and you prefer to masturbate, now that becomes a disease. That's disease now, right? So now anything that is now beyond the normal becomes a disease. Now the second question is masturbation spiritual? No. Masturbation is an invitation for spiritual. You know, let me assure you out there, because I have very good experience with that spirituality stuff. nothing will happen to you, because human race, God created human race to be superior to other races, including angels. And my proof is he ordered angels and jinn and the other entity that made from fire to bow to Adam. So human race is far more superior by God than other races, so we shouldn't be afraid of them. If you are stick to God, you'll be fine. Now, they do not come to you unless they are invited by those evil people that do those kind of things, or you invite them yourself. Masturbation is one of the acts that you invite them yourself, because you're using your imagination, and of course something that is not very clean and not very legit to imagine somebody that you have an intercourse with. So that's an invitation for problems. So I prefer that you go out there, find a nice lady, and get married.
Okay.
Mr. Leo, just to contribute something in that, you see, a lot of persons who finally get spiritual wives or spiritual husbands, most of them practice masturbation.
Yeah.
Most of them practice masturbation.
Correct.
And like doctor said, it is a portal. It's a portal through which these spiritual forces assess you and manipulate you, or say your body. And in such a case where, like a doctor said, you see excesses of behavior in relation to masturbation, it is because at such a moment you can no more control it. It has become an obsession, and that is a spiritual problem. It's a spiritual problem already. And once you start facing that kind of situation, you might think it is something easy to end. No. To begin it is easy, but to stop it is difficult.
Yes,
so you surely need spiritual counsel to handle that kind of issue. And if I tell you, it can cause infertility in the sense that you will not have desire for maybe the opposite sex. And as long as that desire is not there, you have a very low sexual drive. And as a result of that, even erection becomes difficult when you are with your partner. And how do you think you can impregnate a woman when your erection is practically just low? You can't stay pregnant, erected for more than 5 minutes.
Okay.
In such a case, you need a spiritual counselor. You need somebody to handle you on that direction.
Okay. I'm Christian and I'm writing from Limbe. This topic concerns me a lot. Mr. Liu, kindly send me doctor's number. Thanks in advance, Christian. Good evening to you. This one says, okay, I stopped breastfeeding at 1 year. That's the person from Bamenda who said, but you've given a solution already.
She has a problem, yes.
Good evening, Mr. Liu. I always enjoy your program. Please, can I have doctor's number? Irene is writing from Yaoundé. Good evening to you, Irene. Good evening, sir. I'm Christabel from Bamenda. I experienced painful menstrual cramp. Okay. I don't know how to explain that, doctor. We'll do that. You get to him personally. I'm Robert. I can't make love for long. What can I do? From Fontaine. Those are issues you talk it out with doctor. Good evening, Mr. Liu. Good evening, doctor. Doctor, there are times my period comes twice a month. I don't know if it's normal. Please help me. It's not normal?
It's not normal. Okay.
So if your period comes twice, please, it's not normal.
No, it is not normal because, you know, the whole idea of menses is, you know, the egg did not get fertilized and the lining of the uterus gets sloughed off, and this is the menses. You cannot have a sloughing off of the uterus twice in a month.
Okay.
Because you ovulate once in a month, so that means the sloughing is once in a month. The second time is pathological. It's something not normal.
Good evening, Mr. Liu. I'm Jude writing you from Douala. My elder brother has been officially married for more than 8 years today without a child. So please, for the doctor's number, thank you for the great job. Yes. Good evening to the panel. Beautiful topic. please can I have doctor's number? Yeah. Good evening, Mr. Leo. It's Alice from Yaoundé. Please, doctor, what causes regular miscarriage? But hospital says everything is okay. Is doctor in Yaoundé? Please, I need help. The pregnancy never crosses 1 month.
Yes, she has to check for something called toxoplasmosis and rubella. Toxoplasmosis is one of the most common causes for repeated miscarriage. The second possibility is your uterus has a fibroma that has not been identified. Every time the uterus tries to stretch out to accommodate the pregnancy, boom, it cannot stretch out because fibroid is very hard tissue. It doesn't allow the uterus to expand, the pregnancy drops.
Okay. Mr. Leo, evening, please. Your program is so nice. What is the DNA twins? What is the DNA twins? Is Sandra writing from Douala? Sandra, please. I'm not a doctor. It's a doctor that knows these things. Good evening, Mr. Leo. I really do like your program. Can you please ask doctor what can be eaten to build healthy sperms? I'm Jarvis, writing from Bonaberry.
That's a good one.
Yes. Anything that is rich in antioxidant. You know those chestnuts? I don't know.
Yeah,
chestnuts.
peanuts.
Very nice. Yes. You know, anything that is rich in zinc. Okay, and chestnuts and natural things. Not forget about preservatives and all that is good. But you know, to cut through. There are 2 injections that you will take hormone. One is testosterone, one is beta-HCG. We cannot give the injection till we see how much level you have first, and then we give according to the protocol and according to how much level you have. Those are the 2 things that is approved by the American Urology Association. There's 2 injections, beta-HCG and testosterone. Beside that, we're not looking, you know, eating well and all this is very important. You know, we can treat, there's natural ways to treat, but it's a longer way. If you want, you know, the definitive, most effective, then is the injections.
Okay. Good evening, Mr. Leo. I'm Mary Mendy from Kumba. I have cyst on the right side of my fallopian tube near the oviduct, and the left side is twisted. I think egg can't get through. Can doctor help me? That is the result I have from the hospital.
Yes. Well, if the cyst is too heavy to pull down the tube and twist it, that means this is an indication for removal. But you have to be very careful here. There are cysts that go out away in their own by taking the small tablets, and there are cysts that we have to operate. The one that we most likely have to operate is those ones that have solid material inside, not fluid. Fluid is no problem. We can give you some medication and it will be gone. But if it's solid material inside, we call it complex cyst, this one has to be taken out by surgery, and then the tube will be untwisted back.
Okay. Oops. Good evening, Mr. Leo. I'm Vivian from Limbe. I am having serious menstrual pains at the right side of my under abdomen. Can I please have doctor's contact? Okay. Vivian, I pray the doctor helps you. Good evening, Mr. Leo. I'm Maureen from Bamenda. I enjoy the topic. Can I have doctor's number? I wish to talk to him. Okay. You will talk to doctor. Certainly. Good evening, Mr. Leo. Please ask doctor if menses above 30 days is normal. I'm Stephanie from Bamenda. If not, what can be the treatment?
Menses for 30 days? No, of course not normal. that is definitely something wrong. Absolutely.
Okay. Good evening, Mr. Leo. Please, I wish to know whether a pregnant woman can still see her period. Is it possible?
It's possible.
In early pregnancy, we can see spotting, but not menses. Spotting, you know, a couple of drops here and there. Spotting, but not menses. If it's heavy bleeding, that's something else. That's now threatened abortion. Threatened abortion meaning she is about to lose the baby. She is about to lose the pregnancy. But spotting here and there is fine, because as the baby get in the uterus, the baby digs, reaching for food, and the food is the blood vessel, and this is how the placenta is formed. So it's normal during that baby digging to reach for the blood vessel to feed, couple of drops of blood to drop, and you see it. We call that spotting, but not heavy bleeding.
Okay. Mr. Leo, good evening. I wish to have doctor's number. Laura is writing from Yaoundé. Good evening to you, Laura. Good evening, sir. Please, doctor, can you have pregnancy symptoms but you are not pregnant? Linda is writing from Yaoundé. You feel like you have those symptoms?
Yes, you can. This is for those people who, psychologically wanted to get pregnant. So we call it pseudo pregnancy, fake pregnancy. You get the symptoms, you have the feeling and everything, but there's nothing there. This is just because she is maybe dying to have a baby, and she is psychologically hooked on having a baby. So the brain believes it and starts to manifest as if she's pregnant, while in reality she is not.
Good evening, Mr. Liu. I'm writing all the way. Stop calling. Just send me a text message. I will forward you doctor's number. Good evening, Mr. Liu. I'm writing all the way from Kumba. My wife has been for more than 10 years without menstruating. This started when she was 32 years of age. Please, for doctor's number. Okay, you get to doctor, and certainly he may have to help you. Good evening, Mr. Liu. My menstruation comes last month, small, but I'm pregnant now. Is it normal? Please ask doctor for me. It's Queenette writing from Kumba. Queenette, yeah.
What she said? What I didn't follow.
That the menstruation came just, it was not much, but she's pregnant.
Yeah, that's spotting. That's what I just said. It could be just a small spotting. It is normal, but it is better to do an ultrasound to assure the baby health.
Okay. Good evening, Mr. Leo. It's Mary from Boya. Can I have doctor's number? You have a doctor's number there. But doctor, I want us to look at something of, I hear there's something of incompatibility. The man is okay, the woman is also okay, but they cannot.
The rhesus factor.
Yeah, okay, this is something,
yes,
yeah, this is see, this issue arises when the woman is negative. The rhesus factor is negative. And the man is positive. So antibodies will form against the baby. And we give a small injection before delivery, and the issue is resolved. So, of course, all women, there are 9 tests to make. Blood grouping is essential before you get pregnant. So we know your factor, positive or negative. But this is only arise if you have a negative factor, then you should be concerned. But the doctor will know what to do. The doctor will know what to do. If the woman is negative, the husband is positive, we have issues of antibodies, but it's easy. It's a very easy issue. It's easily resolved.
Okay, so the issue of incompatibility, when it comes
is easily resolved. Only it happens if the woman is negative. Only if the woman is negative, the issue arises. But if she is positive, there is no concern. Because she is positive, he is positive, there is no concern.
Okay, Mr. Leo, where is Dr. Soliman's hospital? This is writing from Kumba. Somebody says Mile 18 Boya and Bonaberi Douala. Sumela Calvin is already giving.
Correct. Somebody given the information already.
Somebody, is that true?
Yes, correct. We have one in Bonaberi, and we have the original one in Boya. I've been there for 7 years. 7 years, yes. Since 2015, I'm in Boya, Mile 18, yes.
And there's one in Bonaberi?
There is one in Bonaberi, yes.
Okay, so somebody's asking the question and another is providing the answer. Good evening, Mr. Liu. I'm Nesco watching the program from Yaoundé. Please, I need the doctor's number. Hello, Mr. Liu, I'm waiting. Yeah, you have it there. You people will have to wait because the the requests are just so many. I don't know whether I have time to respond to everybody at the end of the program, but is it time to also understand, let the African family understand that most often when the child is not coming, the problem is with the man?
Mr. Liu, I think women suffer a lot because of that, especially in Central and West Africa. Let me just use it, say Sub-Saharan Africa. Women suffer a lot when it comes to that, because we have a culture where we do not believe, like I said earlier, in infertility. And so with that superior mindset that a man is always fertile, we always push the blame to the woman.
Correct.
And when the blame is pushed to the woman, she is the one who suffers at the end of the day. You see, there are situations where a woman, after she was insulted, accused, and even driven out of a marital home, another woman was brought. She still remained the same, no child. The other woman who went out, put to bed.
Correct.
The question is, who is to be blamed? Every proof is there to show that is the man, because they brought another wife. He could not impregnate the other wife.
Yeah.
So I think it is very, very necessary for Africans to stop the idea of blaming the woman for being the cause of unproductive homes.
Correct.
When there is a problem like that, everybody needs to be checked. The husband, the wife. People need to go to the hospital. I'm sure that marriage is something where the two of us, we get to agree on what we should do. If we choose, for example, when I wanted to get married, I and my wife, we sat down and said, okay, we need 3 children. And our agreement, we had our 3 children and we stopped. If in case we made that agreement, then the first year there was no child, second year there was no child, we'll have to start asking questions. What happened? What is happening? What is the cause? I knew I was fertile. My wife knows she's fertile. Why? Because she had had a child before marriage. I had had a child before marriage. And so in this case, we know we are fertile. But if we come and something is happening, we need to start finding out what is wrong with us. So it is not for one person to be blamed while the other enjoys the favors of the family.
Correct.
Because with the fact that African families are extended, we are not just having a small nuclear family for just few, is extended.
Correct.
When the mother of the boy, or say of the man, waits 1 year after without a child, the person she's pointing fingers at is the woman.
There's no woman.
She is not looking at the son.
Exactly.
When she comes, she will ask birthday, daughter-in-law, why are you not pregnant? And maybe she might have a good reason, but she can't talk because of the fact that in Africa we have respect for elders. And so she stays quiet. At the end of the day, some families tend to blame her. Sometimes these women are even protecting their husband who is having a sexual problem. And she will end up receiving all the insults while the man is there enjoying the favors. So I think, like you asked, Mr. Leo, it is necessary that our African families get to understand that these things happen. And when they happen, the blame don't go to one individual. And we don't get to the place where we think it is impossible to get pregnant. It only becomes impossible when you don't have a womb, or maybe when your scrotum has been been cut out, and which I don't think, if you know you want to castrate yourself, you will not go looking for children. And so in this case, still have hope. That's why we have medicine. Doctors are there to help. I mean, both herbal medicine is there, and modern pharmacological medicine is there to help. There are different engineering methods that are used today which were not yesterday. So I think this is not supposed to be a problem that we should maybe be afraid of. When you are not getting pregnant, don't conclude about yourself. It's not yet over. I just mentioned a friend who stayed for 17 years. And finally, they have a child. But nobody wants to wait for 17 years after marriage. It's not correct. It's not good. So I think we should be patient at times, but we should go to the hospital, meet the doctors. They are going to help in the way they can. But let the blame towards one partner not be the familiar thing as it has always been in Africa here. That's my counsel.
That is correct.
Okay. Many persons are in this situation. What would you advise the families when we get information like this, the in-laws on both sides? The first thing they should consider is to find out whether the children who are in marriage have a medical situation.
You know, let me add something very small. When the family of the husband stresses out the wife to such extent, you know, let me tell you a small medical fact. Stress inhibits the hypothalamic pituitary ovarian axis. So if you stay, meaning what? You know, we said ovulation involves the brain and the ovaries. So this relationship, we call it axis. So when you stress the wife so much, how come you don't have a baby? It's been a year, it's been 2 years. You're stressing her out. I want you to know, when you stress out the woman this way, you are the reason that this woman is not getting pregnant, because you stressing her out. And when you add stress to her, the ovulation is inhibited, meaning is no more ovulation. So how can she get pregnant? How can she get pregnant if there's no ovulation? And again, you are the cause of ovulation. When you nag and ask and bother her, and where is this and where is that, and how come you didn't get pregnant, you are the reason for the infertility. Stress inhibit ovulation. Stress inhibit ovulation. So it could be just couple looking for a child, they're stressing out, where is the baby, how come this, how come that? No, you do what you can, you check yourself, so make sure that you fertile, and then you leave the rest up to God. Whenever the time comes and God decides is your time to get pregnant, you will get pregnant. But as long as you are stressed or have somebody stressing you out over your head day and night, you will not be pregnant because you're stressed. And when you're stressed, you cannot ovulate.
Oh. Okay, when you are stressed, you cannot get pregnant. Now, people who are living in this situation, while they are attending they should go to meet doctors like you. They should also go to pastors for psychological assistance, but they need to change something in their home also.
Yes. You know, take away the stress. You want to change something in your home, take away the stress. Maybe you can have your in-laws listen to this session that please do not stress, because the stress prevents ovulation. And for all those questions, I know Mr. Leo is very tired, tons of questions. You know, I don't know if most of you know that I have a session tomorrow here, 5 o'clock. Tomorrow Saturday, every Saturday at 5 o'clock, I have a session here for 1 hour, almost 1 hour. So have your questions ready. And the WhatsApp number, my WhatsApp number will be displayed. You can send me all the questions, and I will dedicate tomorrow 1 hour to answer all those questions. And think that will be an easier solution for everybody, and everybody can be happy and relaxed.
Wow,
right?
that's powerful.
Yes, but this evening I'm going to send your number to those I can. There's just so many requesting for your number. We are going to be continuing the program treatment for this situation. How do we treat it?
If it's a medical condition concerning the woman, then the first step is we get what is called infectious profile.
Okay.
We can easily determine if the woman is infected or not just by doing a small ultrasound. We look if there is fluids under the uterus or not, fluids around the ovaries or not. And that's an indication for infection, because those fluids normally should not be there. So if our fluid there, that means there is an inflammation. An inflammation comes because of there is an infection. So an infection comes because there is a microbe that you have contracted, most likely during your sexual activity. So we do the ultrasound, see if there is signs of infection and inflammation or not. And in most cases, if there is inflammation meaning things are getting to be swelling. And when we swell, the tube that is very thin, when things get swelling, it gets blocked. So no sperms can go. So just small, simple inflammation can clog the tubes, can block the tubes, because the swelling is, you know, things get bigger. So if we treat the infection, the subsequent result will be subsiding of the inflammation. Things will be normal, no fluids around the uterus, no fluids around the ovaries, no pressure around the tubes, so the tube will become patent and open again, and now you will come in healthy. you are ready to accept sperm and get pregnant. So we start with the simple things first, and then we can go to the second step. Just the other day, I had a 26-year-old woman. It's unfortunate. She had one child, lucky for her, but when I examined her, she said she hasn't had her menses for years. So when I examined her, I looked at the ovaries. The ovaries has no more follicles. Follicles is something that you are born with. Any female, when she get born, she is born with an ovary that is full of follicles, and each follicle contains the egg. So now she ran out of follicles and she ran out of eggs. She can no longer have menses.
Wow.
If you go to a clinic and they give you a tablet and after 3 weeks you see your menses, this is a fake menses. This is a menses because I have given you tablet. If I stop the tablet, you stop the menses. So the real fact of the matter is, if your ovaries has no more follicles, you will not see a menses. So we have to go to somebody who knows how to do ultrasound and look at the ovaries. If the ovaries are empty and no follicles there, we do a hormonal test to confirm that this is premature, before time ovarian failure. But in most cases, the ovaries are working, and it's just because of a simple infection and simple swelling, we cannot get pregnant. So my advice, again, as I said in the very beginning, if you suspect you have an infection, get it checked. Do not wait till you see signs and symptoms. If you suspect, you should get a check. And how are you going to suspect? You slept with the wrong guy or the wrong lady, This is how you suspect. So you're going to get it checked before you take this infection home, and then you infect the family. So get it checked, and then, continue your life. Better yet, prevention. Be careful when you do protected sex, or like much better, do sex with the family, with your wife. That is my advice. But the treatment is quite easy sometimes and quite simple. We don't have to go to IVF and those big fans and that cost millions and millions. The solution is in your hand. Get regular checkups. Make sure you always clean. Okay, and then you wouldn't have any problem unless it's congenital. Congenital meaning you were born with it. Okay, so that is my advice to everybody out there. Prevention is much better way to treat, much better than treatment, because if you wait, you're gonna get complicated, and sometimes things, when they get complicated, we cannot reverse it back. It's irreversible.
Good evening, Mr. Leo. Please, I wish to have doctor's phone number. Okay, yeah. You have doctor's number. This one says, I'm David in Kumbako Sala. Please kindly send to me doctor's contact number. Oops, yeah. Mr. Leo, please, for doctor's number. Doctor, you won't sleep this night. Good evening to you all. Mr. Leo, please, for doctor's number. Frank Mutu, writing from Cape Town. Good evening, Mr. Leo. I love the wonderful program of today. Above, please, for doctor's number is Levis from Bomenda. Okay. Good evening, Mr. Leo. I am enjoying the program. Vivian from Yaoundé. I'm 27 years old and I rarely see my menses. It comes about twice in a year. I went to the hospital and was diagnosed of PCOS, something, I don't know what PCOS.
PCO, polycystic ovarian disease.
Okay. I have never gotten pregnant. Please, doc, can I be pregnant? Please, for doctor's number. Is it possible, doctor?
Yes, it's possible as long as there is no virilization, meaning she doesn't have man-style hair on her face. Then it's possible.
Okay. Mr. Leo, please send me a doctor's number. I'm Martha Angan, writing from Kumba. Good evening to you, Martha. Good evening, Mr. Leo. I'm Ebude from Yaoundé. Doctor, can cyst cause miscarriage? I got pregnant while having cyst, but the pregnancy didn't last for 2 weeks. Please, for doctor's number, is it?
It's not possible. Cyst is away from the uterus. Unless the cyst is huge, then it's compressing the uterus. Otherwise, the cyst is something in the ovaries and the uterus is totally something else. Unless otherwise, the cyst is so humongous that presses on the uterus, then it can cause miscarriage.
Good evening, Mr. Leo. Good program. Please, I need doctor's number. Maurice is writing from Boya. Good evening to you, Maurice. Professor Mark Anthony, the doctor, let me stay with you. There are persons who go to medical, to doctors for over 10 years without a solution? What would account for that?
They have been misdiagnosed.
Okay.
If you go for 10 years and the problem is not solved, you're being misdiagnosed. So my opinion is, if you go to somewhere and the problem still persists, maybe it's time to go to somewhere else. Get a second opinion and a third opinion.
Good evening, Mr. Liu. I'm 32 and a father of 2, but have been suffering from sexual weakness since my first sexual experience. I've never experienced any early morning erection. I also like to have doctor's number. Frederick writing from Bamenda.
Yeah, that's most likely a hormonal problem. That's most likely a hormonal problem, yes.
Okay, and hormonal problem, how do we fix it?
We give hormones. Whatever is missing, we substitute. And we have to look, why are we missing hormones? We have to check the testes. This is the home of the hormones, testosterone. And testosterone comes in 3 different forms. There is testosterone that is responsible for the hair distribution in a man. Then I will ask him, have you noticed that your shaving time has increased? And instead of you shaving your beard every 2 days, now it's every 1 week? Have you noticed that you're losing hair from your body? If the answer is yes, then testosterone is low. Then we need to work on that. And we need to find out why testosterone is low.
Mr. Liu, my partner said I have impregnated her and I took her to the hospital and the result was negative. But after 4 months, she came back saying she was pregnant for me. Is that possible? Sixtus writing from Camden. Sixtus, that one is...
No, the professor is laughing. He answered this one.
Yeah, good evening. Please for doctor's number. Good evening, Mr. Liu. I'm enjoying the program. Please, can I have doctor's number? Irene is writing from Bomenda. Good evening, Mr. Liu. Is Constance writing from Bomenda? Please, for doctor's number. Oops, means that we already sharing the number. But now,
today's number sharing.
Yes, Professor Mark Anthony. Yes, the problem is quite serious.
Yes,
many families are dying in silence.
True.
Yes, they just don't want to talk about it.
That's right.
It doesn't mean the problem does not exist. The problem is there. They're just shy to talk about it. A man is shy to talk about his problem. The woman is being bounded by the family of the husband. You know why you don't have a? It's a really stressful situation, especially in Africa. And also we have to understand it is not the woman's fault. Sometimes, not even 50% of the times, is the man. Is the man's fault. It's just who carries the blame, like my colleague here explained, is the woman.
The woman.
It's the woman who is carrying the blame,
Yes.
Professor Mark Anthony. But the key to this is that the parents can parents be blamed to some extent for not doing a quick medical checkup for their children, especially when they start getting to adulthood?
Well, normally I don't, the culture in Africa, we have sex when we get married. I mean, this is most of the people. I mean, maybe it has been different lately with the new generation, but most of the blame falls on sexually transmitted disease.
This is it.
So
Okay.
good education from the family, from the schools, from the education system, sensitizing the public that sexually transmitted disease, especially when you take it as young, 16 years old, they come with chlamydia. They shy to tell the families that they have sexual encounter with this or with that. And so they keep it to themselves. I don't know if we have enough time. I had once a 24-year-old female, beautiful girl, okay? And she came, she could not even walk. She came, she was carried, okay? And I asked her, when was your last menses? She said, I just had my menses. So now you exclude the idea of being pregnant, right? But I always do, ultrasound. It's like ABC.
To confirm it.
Yeah, I look and I see remains of pregnancy. The head is in one place, bones. The skull is in one place, the leg is in one place, the arm is in one place. You understand? So what did she do? She got pregnant. She got pregnant and she went to the quarter. Somebody put something there and started up and down, dismantled the child, and she got infected big times. Big times. Right? She got infected and she doesn't want to tell the family, yeah? So when I have the right education to the children, they're not children anymore. You're an adolescent now or an adult. So when I have the correct education to them, then it's most likely it will work.
True.
You don't have to be afraid of your father or your mother. Listen, but advice. And also parents are sometimes shy to talk about these issues with their children, which is wrong. Because if I don't educate my child now, he's going to get his education somewhere else, and it possibly is going to be the wrong education.
That's right.
And then we're going to fall victim for those things that is happening now. You know, to have a sexually transmitted disease that eats away your testes, it's been there for a very long time. Yes, and by the same token, the ovaries and the reproductive system of a female, if you have a sexually transmitted disease for a long time, is eating you up. So get checked. You cannot lie to yourself. If you know that you're having sex, get it checked. And make sure the person that you're having sex with is clean.
Healthy.
Is clean. So you don't have, then when you grow up and you want to have a family, you know, you are clean. You are ready to have a family.
Good evening, Mr. Liu. I'm enjoying the program. I once had a sexually transmissible disease and neglected it for more than 6 months because I was ignorant, but later consulted and was treated. But the issue is right now, I don't have my morning erection coupled with premarital ejaculation. I'm Eric, writing from Bamenda. Stop the calls, please. Just send your message. Which are Dr. Soliman's consultation days in each of the hospitals?
All right, let me answer the first one first, the question that he hasn't for 6 months and he treated it. Now the big question is, when you treated yourself, have you treated also your sexual partner?
Sexual partner.
If you have not treated your sexual partner, as if you've done nothing, because you're gonna get treated, you're gonna go back where you get the microbe from, and you're gonna get it back. So when we treat a sexually transmitted disease, both partners have to be treated, and at this time of treatment, no sex, and most likely no alcohol, because some drugs react with alcohol. Now, my working days in Buya, I'm there Tuesday till Friday, and in Bunaberi, Saturday till Monday. Those are my working days.
Okay.
So, and again, everybody out there, I'm here tomorrow, 5 o'clock. All your questions will be answered.
Okay.
We'll make it easy.
Dr. Bisong from Kumba says, what could be the cause of small family nowadays? Our parents had 12 children, single births, and even 14 children. Dr. Esther Bisong. Thank you, Mr. Liu, for your good work. Today's choice of topic is very good. Can I have Doctor's number? We're writing from Kumbu Bui Division. I'm sure I dropped this number in this to you guys already. Tagen Donatien says, good evening, Mr. Liu. I want to be the doctor's apprentice. It's Tagen Donatien from Bamenda. Thank you.
Come and meet the doctor.
Yes. We have just 10 minutes to go. There is need for an intensification of education on this topic.
Yes.
To save many more families.
That's very right, Mr. Liu. You know, when there's somebody who asks a doctor to teach the menstrual cycle, and I was a little bit disturbed because I think from the age of 9, girl children need to be educated on that from the age of 9. They are supposed to be taught their menstrual cycle because you don't know when it can pop up. And most of the times, because in our African communities, we are, in fact, we feel reserved in discussing things like this with children. We don't give them sexual education. We allow them to discover it for themselves. And when we do that, at the end of the day, the first time, it becomes like a shock to the child, and the child starts feeling shy. Yes. You don't know what can happen. The child can go to somebody else to get counsel, and the person will give wrong counsel, and that is how your child is destroyed. And so I think we should give sex education to children as young as they are. Let's say I'm talking of 9, even from the age of 8, we can start giving them sex education, especially girls, because with their case is different.
Yes.
Once you know how to control this and you know your body, it can help in a lot of ways to even protect your future. I mean, when it comes to productivity.
Correct.
So when you are scared of telling your children or informing your children at time, then you are already preparing them for a destructive tomorrow.
Yeah.
And so I think that the way we see sex education in Africa needs to change. And we should make sure it becomes a normal discussion in every home. Because you don't expect that the teacher should best inform your children than you. We are not refusing that the schools do their best in educating. I learned how to teach menstrual cycle when I did biology in secondary school. I can talk about a woman's menstrual cycle well to her, teach her how to follow it. But I learned it when I was in secondary school. And I'll be sincere in telling you that I used to help my wife for that.
Okay.
And she got to understand even her menstrual cycle, because she used to claim that she's having 21 days. And I think doctor made a statement here, which when you follow your menstrual cycle beginning from the first day of menstruation, it becomes easy. It becomes very easy. And so this education needs to be given to children at home. At home.
Okay.
Let them know it.
Good evening, Mr. Liu and the panelists. Please, can someone decide to conceive of a male child? Please, for doctor's number. Hassan is writing from Bamenda. This is also a problem.
You can decide.
Well, I do not think so. We cannot really, even with today's technology, unless you do it outside. And you have to do genetic testing to see which sperm have the Y chromosome.
Wow.
And that's very delicate, and that is needs a lot of advanced technology to do that. When the man ejaculates, is about up to 300 million sperms are swimming and racing to meet that egg. Only one sperm is allowed to go inside, and after this, the egg is shielded. Nobody else can penetrate.
Yes.
Only one sperm out of the 300 million. That one sperm, is it a Y sperm and that will make a boy? Or is it an X sperm and that will make a girl? You cannot really tell which one is going to win the race unless you do it outside in the lab. And you know which one is Y and which one is X, and you fertilize the egg, and then you insert the zygote to the uterus where the pregnancy will be carried. Beside that, I don't see it possible. You cannot.
Maybe you confirm these thoughts, or maybe a theory that was presented to us when we were in school by a biology teacher, where he said the Y chromosomes run faster than the X chromosomes, and the X chromosomes have lesser lifespan than the Y chromosomes. No, the Y chromosomes have lesser lifespan than the X chromosomes. Yeah. And he said, if you want to actually impregnate a woman and be certain that it's a boy child, you should you should have sex with your wife on the day of ovulation, because by doing that, the Y chromosomes run at a higher speed, so they will be the ones who to ovulate, to fertilize the egg. But if you want a female child, then you need to go, might be a day before or a day after. So I don't know how that theory can it be. Is it really effective? Because that's what he told us and taught us, and say that it's possible for you to identify a day and give birth to a boy child.
Yeah, it's a theory, like you said.
Yes, a theory.
But the best way to track whether the woman will get a boy or a girl is looking at the genetic history. Let's say you're a female out there and you're interested in boys. So you're going to go to somebody, you pick up a fiancé, after you study his genetic tree, that this man from this family can only bring boys. Because his father has five children, boys. Wow. And his grandfather has 6 boys. And his grandfather has 10 boys. So obviously, this family can only produce boys. Wow. Or boys more than girls. Maybe they have a couple of girls there and there. So it's the genetic history. The genetic history that determine what is most likely the generation to come. Is the genetic history. I mean, this is the most secure way, because maybe your theory maybe stand, I have no idea. But honestly speaking, the genetic history, if you want a male, then you track the family. How is the father? How many boys the father has? How many boys the grandfather has? And that determines this son coming from this family his most likely production is boys. But myself, I like girls too, you know.
Yeah, theory is more effective because if I look at my genetic tree, I realized that my grandfather had more girl children, my father had more girls, and even I have more girls.
See, it works better this way, tracking the genetic tree.
Okay, tracking the genetic tree. We are going to be concluding this program at this juncture. We're supposed to discuss two topics, but because of the messages, I have hundreds of messages here. I hope that I'll have time to forward doctor's numbers to you guys after the program. Doctor, thank you for coming.
Thank you very much, Mr. Leo. I appreciate, and I really appreciate the listeners and the viewers out there. You have a blessed night, and you have a nice and wonderful weekend, and stay safe.
Thank you to you, Professor, for coming.
Thank you, Mr. Leo, for the opportunity. I want to remind our people out there that in a generation in which we live in, it is no more a taboo to discuss sex education at home. It's no more a taboo to explain your health problems, because by explaining is already getting half solutions to your problem. So I think we must get to that space where we can see some of these things as normal. They are not strange.
Okay, we want to thank you all who took time off to watch this edition of the program. Thank you also to the production team. Stay blessed. Bye-bye.